What's happening, family? Dr. Joe here. Happy Sunday evening, and I hope each of you are well and blessed wherever you're tuning in from, and if it's in whatever city, state, whatever country you're in, whatever part of the world you're in. I'm so glad that you're here. Good to see everybody's face up in the place. Salute to you guys. I'm so excited about tonight's discussion, but I want to take some time to salute everyone to be certain that everyone is well and blessed. I'm Dr. Joe, the author and founder of the world's greatest transformational process, the 40-day turn-up and the Journey 3.0 Plus process, and I'm glad you're here. Tonight is what we're calling, and we're having a season finale of what we call Village Chat. We are in our fifth and final week of our process. I've been working with a great group of people. Shout out to all of the Rebirth folks, the 40-day turn-up elites, thousands and thousands of people we have been working with since the end of January. The process officially started the very first Monday in March, and here we are entering our last week, and this group is doing a fantastic job reducing blood pressure. We reduce blood pressure by 23%, the systolic and the diastolic 27%, taking people out of hypertensive crisis levels to almost normalized blood pressure levels, reversing diabetes. People are getting off of medication. All of this has happened within the course of 6 weeks, and we've got all of the statistics to support it. And it's just great that so many people are able to get so much out of what it is that we're doing. Village Chat is a time and opportunity for us to normally spotlight our participants, but on tonight, we've got a special episode. On last year, I was able to meet an amazing physician that's local in the city of Atlanta that I am in as well, and we just hit it off. She has a vast knowledge of what she knows, who she is, and what she's going to be able to speak to. I'm not going to take time to talk about that, but I'm going to let her tell her own story. So, Village, I want you guys to welcome my special guest, Dr. Naiden. I'm so glad that she's here. Dr. Naiden, how are you doing on this evening?
Hi, I'm great. It's great to be here with you.
Yes, it's so good for us to connect. How has your year been thus far?
It's been a really good year.
Okay, well, it's been a good year. Well, thank you for accepting my invitation to be on board with us on tonight. I've got a lot of great people who are going to be tuning in on tonight and the next coming days. We're excited about this. And I just want to take some time for us to maybe have a conversation. Gang, what we're going to do, I'm going to have this conversation with Dr. Naiden, our guest. And then near the end, she has already said that she's going to avail herself to answering a few questions. So we're just going to get into the conversation. Dr. Naiden, let's start off and just tell us a bit about yourself, where you're from, where you live, and what do you do?
Okay. Basically, I'm a board certified OBGYN. I was born in Brooklyn, New York. I grew up in New York and in Connecticut. I did spend some time in Jamaica. I went to a British boarding school for about 5 years, and then my parents brought me back. Then I moved out to Seattle, Washington, and went to college there. And then I left college and went to medical school at a place called Case Western Reserve in Ohio, in Cleveland, Ohio. Then I worked for Kaiser for 2 years. I went into the public health service for 4 years because they had paid for my medical education to give them the time back. And then I did a residency in both OBGYN and I did internal medicine also. So I became boarded in OBGYN because I always wanted to serve women. Then after that, getting a little discouraged with traditional medicine, I went and got boarded in integrative holistic medicine and did functional medicine also. So that's what my background.
Wow, you said so much. So we got to we have to unpack it. Is being a doctor, when you became or pursued that career path of being a physician, going to medical school, etc., was that something that you wanted to do your whole life, or what kind of led you to that?
Actually, no. What happened is I wanted to be a child psychologist most of my life. And then when I went to University of Washington, I went and visited some free clinics. And basically, they told me that you could do more as a doctor than as a psychologist. And I had actually never taken a chemistry course. And then I took chemistry and physics, and I did really, really well, and then decided to apply to medical school. So had I not gone to the free clinics, I may never have really entered medical school.
Wow, it's amazing how God pushes us and how we find our paths, you know. So that's amazing. Now, talking about that and going to medical school, getting your degree, doing your residencies, studying, you said that you became frustrated or about the healthcare system. And then you went from traditional medicine to holistic medicine. Talk to us about what led you the holistic route.
Okay, so traditional medicine, really, you treat symptoms. People come in with a problem and you treat that problem. And usually when you're specialized, you treat that part of the body. So I'm an OBGYN. Normally I would just treat women and treat their female problems. When I had two patients that actually were referred to me, they were 22, and one came in because she had bleeding, and the doctors had treated her with birth control pills, which is a normal thing to do over and over and over again. But when I saw her, I decided to do some further testing. And when I did, she ended up having a mass in her uterus and ended up with endometrial cancer and dying at the age of 24. That was the first thing that said to me, there's got to be a different way to do medicine. But then a second thing happened where another patient was referred to me by her mother. She had a small breast mass, having just delivered a baby with another doctor who told her it was pretty normal. When I examined her, the mass was painless, and I sent her for a breast biopsy. It turned out to be breast cancer, and she died at the age of 24. She was 22. So that made me know that I had to do something different. Diagnosing was just not good enough. I had to find a way to maybe prevent these diseases or at least decrease risk. And so that changed my path of medicine to go into integrative holistic medicine and functional medicine.
Wow.
Now, let me just tell you, functional medicine is trying to find the etiology of the problem, not just treating the problem, but finding what the cause is so that you can go change the cause as opposed to just treating the symptom.
That's fascinating. And that's such a tragic story that those young women lost their lives. But still, at the same time, we see the silver lining in that it inspired you to pursue the holistic route so you can help. And I'm certain that you've, helped redirect so many different people. So that's great. Now, Dr. Naiden, I know we've spoken, but one of the things that I want you to know is in this particular class that I'm working with now, that I've been working with since the end of January. It's we've got about 2,135 people who are still in the process. They're in 9 different countries, and 91% of them are women. So my major audience is women. So what you do, what you stand for is, and the subjects that we're going to cover on tonight is speaking directly to them. So I'm so excited to be presenting you to them. So what I want to ask you, let's first start with cancer. As you know, all of us know someone who either has cancer, passed away with it, struggling with it, or has had it once before. And it's just become, such an enigma to us and to our society. What do you feel is causing these exorbitant rates of cancer over the last 15 to 20 years?
Okay, so if we go back, what we'll say is that 1 out of 3 people in their life is going to develop cancer. Doesn't mean that they're going to die from cancer, but 1 out of 3 people that's in the United States will develop cancer before they die. Okay, and I think there are a number of causes of cancer. Okay, one is the immune system, because your immune system is like the police that guard your body. So if you have a weakened immune system, if there are cells that are abnormal, the immune system doesn't recognize it. And then if there are lots of abnormal cells, then the immune system becomes overwhelmed. And so therefore, that's one way that cancer can take over, because the feeling is that you always have abnormal cells or cells that could be precancerous or are cancerous, but your immune system gets rid of them. Now, what causes these cells to become abnormal are a number of things. It can be the air that you breathe, believe it or not. It can be the chemicals that you take in. It can be partly the stress that you're under. It can be the drugs that you take. It can be, and people don't want to talk about this, but it can be EMF frequencies, electromagnetic frequencies from cell phones. All those things can impact the cells. And if the cells actually change, their DNA changes, they split, and then they start multiplying abnormally, then you get these abnormal growths and the immune system can't handle it.
Wow, that's fascinating. So basically, so many elements of how we live our lives. It's not just one thing.
Exactly.
It's like a soup of different ingredients. Wow, that is fascinating. If a person is diagnosed with cancer, if someone is watching this and they're diagnosed with cancer, talk to us about what are some things, because people really don't think there's anything outside of chemotherapy, radiation. What steps should a person take if they're exposed to that? When you talk about that 1 out of 3, what should we do?
Okay, so if you are diagnosed with cancer, in every book that you read about cancer, one of the things that really feeds cancer is sugar. And the first thing you have to do, I mean, you should be doing this even before you get cancer, but you should really eliminate sugar. And sugar comes in many, many forms. And Americans really have no concept of how much sugar they're actually taking in per year. So when you drink, and I don't want to, if you drink orange juice that you buy in the store and you turn it around and you look at the sugar content, one serving, 8 ounces of sugar of orange juice can have up to 26 grams of sugar. Now, that's just one glass of orange juice. We talk about bread. When you eat bread, it's a starch. It breaks down to sugar. When you eat white potatoes, it turns it into sugar. When you eat cakes or candies. So we know that cancer cells are fed by sugar. The PET scan that we do to look at where cancer cells are, it's a radioactive sugar iodine, because the cancer cells will pick up the sugar immediately and they can tell where the cancer is with the PET scan. So sugar to me is the number one sort of problem with our diet. And so if you have cancer, the first thing you have to eliminate is sugar. I mean, no ifs, ands, or buts, okay? The second thing that you want to do is you want to alkalinize the body. There's acid and there's alkaline. Cancer cells do not grow well in alkaline fluids. Cancer cells actually can produce acid. And so you want to make the body as alkaline as you can possibly. And that's done by eating a lot of greens like kale and spinach, broccoli. Those things will really, really help. Eating celery, drinking celery juice, those things help to alkalinize the body. Again, people should be doing this long before they get cancer. But if you get cancer, you want to do those things. Now, there is a controversy about the feeling is that it is better not to eat red meat when you have cancer. But you have to take in some form of protein. So if you're not going to eat red meat to get protein, because you're going to lose muscle if you don't take in protein, you really have to take in different kinds of beans for sure, like kidney beans and lentil beans, and black beans. So you really want to change your diet.
Wow. I'm so glad you said that. I've been preaching and talking about this. Everyone who's in our group knows and has been exposed to a lot of the conversations that we're having. And I'm so glad that you're speaking to it, because one of the biggest mistakes that I see people make when they are diagnosed is nothing about their lifestyle changes. They go to radiation, they go to chemotherapy, their diet doesn't change, their lifestyle doesn't change, their exercise habits do not change, what they're drinking does not change, nothing. And it's just basically a soup that's waiting to come back and do the same thing. So, that makes perfect sense. So I hope you all are listening to this, keep this in mind. Now, let's talk about some alternative treatments. Are there other things that people can do if they have cancer that will help them as they're going through therapy? Can you speak to that?
Okay, and I think it also depends on the kind of cancer that you have that you'll get alternatives. Okay, there's something that I truly believe helps a lot. I think there's something called LDN, low dose naltrexone, and again, because there's not a lot of money in it, there hasn't been a lot of research. But if you look at other countries like in Europe, they're used, and it has no side effects, but it helps to build the immune system, because that's what you want to do. You want to build your immune system. And the big cancer therapy drugs are like immunotherapy. Immunotherapy is much better than chemotherapy, because immunotherapy is actually used to build the immune system. Unfortunately, immunotherapy is very, very expensive, and they're just beginning to make it available to some people who have cancer. It's not available to everyone. More often it's chemotherapy. Other things that are recommended, and again, in this country, it has been pushed, but in other countries, you see it, is high dose vitamin C, giving high dose vitamin C IVs, because vitamin C to cancer cells looks like sugar. And so the vitamin C actually will enter the cancer cells and help to get rid of them. So those are some of that's the big thing, that if they would put some research into it, I think they would see that vitamin C really can make a difference. And there are small studies. Some people are using, for breast cancer, they're using iodine to treat breast cancer, iodine. And iodine is very inexpensive. It's simple. But again, there are no real big studies because Big Pharma sees that there's no money in it. So why should they invest millions of dollars to prove that it works if there's no money in it?
Right.
Yeah.
So basically, just because we don't see these studies that are massively available doesn't mean there's not relevancy into their efficacy of these different conditions. And that makes perfect sense. And I'm so excited that we're having this conversation now.
And let me just tell you one other thing that's very, very important.
Please.
Sleep is extremely important. Sleep is something, if you don't sleep 6 to 7 hours a night, you're not going to build your immune system. You have to be able to let the body rest. So you have to get sleep. And
what are some things that people can notice that is an indication of a weakened immune system?
Okay. All right. Most of the time, you can get colds, you can feel fatigued, you can get a little bit of brain fog. You can most of the time you just are more susceptible to things that are around you. But a lot of times, by the time the immune system has really broken down, it's so far gone that the cancer has already taken effect. What's much better is to just keep building your immune system as you go along, as opposed to just hoping that it will work. And genetics definitely play a part, because not everybody exposed to the same thing is going to get cancer. I mean, there are people that smoke that never get cancer, and then there are people that smoke that definitely get cancer. So again, your genetics does play a part, but it's not as big a part as people think.
Fascinating. So we got another topic, dementia. Okay. It's, once again, we have another, problem that we're seeing so much of. A lot of people who are watching this have mothers, grandmothers, aunts, uncles, fathers that they're caring for who have all different forms of it. If it's vascular dementia or Alzheimer's or various, I know there are various forms. Right. You talked about preventing that. Talk to us about that and some of the things that maybe cause it, or what we can do to care for that.
Okay, so the feeling is, again, sugar and Alzheimer's are connected. They feel that sugar plays a big role in people developing Alzheimer's. There is a gene that you can test for to see if 60% of the people who have Alzheimer's have what's called an APOE gene, which is a 4 out of 4. Now, it doesn't mean that if you have that gene that you will definitely get Alzheimer's, but it means that if you got tested for that gene and you had it, you would want to do certain things to make sure that you counteract the possibility of getting Alzheimer's. So some of the things that you want to do is you really want to be physically active. You want to do, either swimming or cardio exercise. You want to exercise to keep the blood flow going through the body into the brain also. You want to also do, I'm going to tell you, there's something called Elevate, okay? It's just a 10-minute app that you can put on your phone that you can actually sort of play a brain game, a brain teaser game, because you want to make new pathways into your brain. You want to make sure that you're always growing, learning and educating yourself, whether it's reading a book, whether it's learning a new game, helps the brain to make new pathways. So those are little things that you can do. The big thing to me, and I know this is going to sound crazy to a lot of people, is the brain is made up of mostly fat. And there are studies that show that if you do coconut oil, if you do 28 grams of coconut oil per day, it helps to protect the brain. And there are books, I mean, there's definitely a doctor, a pediatrician whose husband had Alzheimer's. And it was so bad that he could not even be put on any of the drugs or the studies. And she went and researched, and she started treating him with coconut oil. And within 6 weeks, his brain started to get better and better and better. And she actually had the studies. Now, she went to the Alzheimer's Association, and she tried to talk to them about coconut oil. They would not listen to her because there is no money in coconut oil. Mm-hmm. So again, I really think we need to be looking at preventing Alzheimer's. I mean, once you get it, yes, we can talk about how can we get it, how can we make it less of a problem. But I think we need to start looking at how do we prevent this problem.
Now, you bring up an interesting point that I'm aware of, the APO gene that you were talking about.
Yes.
And there's a study called the Nigerian Paradox, which speaks of how there's such a high degree of that particular gene in Nigerians, but they have a lower expression of dementia. And they were taking this study and comparing it to Black people here in the United States with these individuals who have this gene, and what they were looking at is in direct connection with what you're talking about. And it comes down to diet and lifestyle, the processed foods, the seed oils, the refined carbohydrates, the sugars. And like I always say, genes may load the gun, but lifestyle pulls the trigger.
Exactly. Yeah.
Wow. That is fascinating. So basically the things that we can do to prevent that: exercise, basically things that we all need to be doing: plant-based eating, avoiding the sugars, things of that nature.
And if you're going to use coconut oil, you want to use coconut oil that's unrefined, and you want it in a glass bottle. You don't want it in a plastic bottle because the coconut oil will leach stuff out of the plastic. Mm-hmm. You definitely want it in a glass bottle, and you want it unrefined, because if it's refined, it goes through petroleum. So you want unrefined coconut oil.
What are some things that, in terms of micronutrients, vitamins, what are some things that you think everybody needs to be doing on a daily basis in terms of supplementation? Okay,
so I think every person should have a vitamin D level. They should have a red blood cell magnesium level and a red blood cell zinc level. They should have a B12 and a folate. That's just general. And every insurance will cover that. And even if you had to pay out of pocket, it would not be a great amount of money to pay out of pocket to find out. You want to find out what your levels are to find out how much you should take. Because to me, just taking something and not knowing where you're starting from and where you want to end up can be a problem. But vitamin D3, which is the natural form of vitamin D. Vitamin D2 is synthetic. It's what a prescription is written for. They can write for synthetic vitamin D, but they can't write for the natural form. But if you take vitamin D3, it should also have vitamin K2 in it. And the reason being is that vitamin D allows you to pull in calcium into the blood. And you want the calcium to go into the bones and the teeth. And the only way that will do it is with vitamin K2. Now, normally, when we ate meat, red meat, and the cows were fed grass, they made vitamin K2. But now the cows are fed grain, and they don't make vitamin K2. Yeah. So you don't get it from if you eat red meat.
No, I'm so glad you're saying that, because the quality of the meat from grass-fed cows, as how they should be, versus grain-fed, is completely different.
Yes.
And so once again, it's really a lifestyle thing that we're talking about. A lot of people have heard about vitamin D3, but a lot of people are blindly taking it without knowing their levels, and it can be something that you can overdo. So can you speak again to the importance of getting those tests, as well as can you mention the other tests and then I'll try to write them down and make a banner. What are those tests? I think you said vitamin D3, zinc.
Red blood cell zinc and red blood cell magnesium, because you want to know what's actually in the red blood cells, not just in the bloodstream.
Okay.
And then vitamin B12 and folate. Those are the least things. I mean, there's so many other things, but those are the most, I think, important. And then the other thing you have to know is that vitamin D is a fat soluble vitamin. So
Right.
you have to take it after you eat. You cannot take it before you eat. If you take it
Mhm.
before you eat, you won't absorb it.
Right. Right.
So
Yeah.
it's important. You can take it up to 4 hours after you eat, but you have to take it after you eat.
Excellent. No, this is great conversations. Now, switching subjects, being an OB/GYN, starting in that discipline, you've helped many women. And
So,
menopause, I'm certain, is something that you know a lot about. Can you speak to us about what menopause is? And I know a lot of women are out there and they're having issues. Can you just speak to that in whatever way you feel is most relevant?
sure. First, let's menopause really is the pause of menses. Women will come to me and say, well, when is menopause going to be over? Well, menopause is never over once you go into menopause because it just means pause of menses. That's menopause. Now, the symptoms of menopause, some women will have symptoms and some women will not have symptoms. Okay. Some women will have night sweats. Usually, the way menopause appears to most women, once they stop having cycles, their period stops. And if your period stops for a whole year, you're in menopause. And you really should never bleed again once you've not bled for a whole year. Okay. If you bleed 1 month and then 2 months later you bleed again, it's more like perimenopause. You're not truly in menopause because you haven't paused your menses. Okay.
Mm.
Now, usually when women in perimenopause and menopause, the first symptom they'll have is they won't be able to go to sleep. They'll think it's that they just can't sleep, but they'll be out at 12 and 1 o'clock and they'll just say, I just don't feel sleepy. Well, that usually is a change in the hormones. And so your sleep usually falls first. Then some women will have hot flashes. I call them hot flushes because you get flushed. You can wake up at night and you're hot and you're throwing the covers off, or you can be in a meeting and you find that you're sweating all over and it only lasts for 3 or 4 seconds, but it's there and it can be very uncomfortable. And that has to do with the hormonal changes that are going on in the body. The third thing that can happen in menopause is that your sexual libido can change. You can find that you don't have a desire for sex or you don't enjoy sex as much as you did when you were younger. So those are symptoms that you can experience. Now, some women will not experience any of those symptoms. They'll be in menopause and they'll say, well, I don't have any symptoms. Now, I'm probably a little bit different than most doctors in this. I do believe that replacing hormones is important. And I think that, but it's depends on each woman and what they want to do and how they feel about it. I think when you, in past generations, when women reached the age of 50, they usually weren't working anymore. Now we have women that are 65 and 70 that are doing the same thing they did when they were 40. So the requirements and the stress on them is very, very different.
Mm.
And so I truly believe that it is worth looking at the hormonal levels in women, looking at the symptoms they have, and then deciding how or if you are going to replace those hormones.
Mm.
And there is a book called Estrogen Matters. It was written by a GYN oncologist who's a cancer specialist in women cancers, and he strongly recommends that you balance the hormones and you replace them.
Mm.
So, but I talk to each woman individually because it's an individual choice of whether you decide to replace your hormones or not. But it definitely makes a difference mentally and physically.
Fascinating. Dr. Naiden, why is it, and there are a lot of theories about this, why is it that so many of our African-American women have issues with fibroid tumors? Why is that something that seems to plague our women?
Okay, so the feeling is that fibroids, and they don't, probably if you went back to the origin of fibroids, wherever they started, possibly in Africa, possibly, there was probably some protective mechanism of why fibroids occurred. We don't know what it is because we haven't really researched it. It's just like sickle cell disease. There's a reason why sickle cell disease, came about. It was protective if you only had the trait. If you had the disease, then you had problems. So I think if you were to go back and look, there must have been a reason why fibroids developed. But the reality is now we know that fibroids are fed by estrogen. And we know that when women go into menopause, if they have fibroids, those fibroids shrink. If I give a woman a drug that puts her into menopause, her fibroids will shrink. So we know that hormones feed the fibroids.
Hmm.
Why so many women, especially, I mean, and actually it's not just African women, they're actually in the Caucasian race, you also find fibroids, not to the extent that you find it in the African American race, but you definitely find it in the Caucasian race.
Right.
Well, one of the things is our diet. You know, if you eat red meat and if you eat chicken, there are a lot of hormones in the red meat and the chicken. So you're getting estrogen from other sources other than your body. Okay, that is one problem. If you're overweight, your fatty tissue produces excess estrogen. And so that can also be a cause. And then there probably is a genetic factor, which they haven't really discovered, because there are young women in their 20s that will have fibroids. And so there are probably, again, multiple factors. But again, at some point, there must have been a protective reason why we developed fibroids. We just don't know what it is. And it's not that way anymore.
That all makes all the sense in the world in terms of the genetic factor, connecting it with, like a sickle cell, and, why it was exclusive or something that you primarily see with people of African descent. But also what you were talking about in terms of how estrogen feeds those tumors. And we know that people who are obese have higher levels of estrogen that is directly connected to diet. And once again, sugar and all the other things that you're talking about, that seems to be a common thread in everything. So that's fascinating. One person asked the question about the author of the Menopause. I'm trying to think of the book that you just mentioned.
It's called Estrogen Matters.
Estrogen Matters.
Yeah, what they can do, just Google it. I don't remember the author.
Okay, that's fine. So, gang, you all can Google Estrogen Matters, and I'm certain that you will pick it up. Let me let's see. All right, we've got one question. I'll tell you what, gang, let me hold, because I got a couple more things I want to bring up with Dr. Naiden. We'll get to the questions near the end. A couple more things, Dr. Naiden. What were the most common things that you saw, problems, when women would come in to see you and the women that you were treating? Can you talk to us? What were some of the most common problems that women were experiencing?
Okay, it probably depends on the age group.
Okay.
Because different age groups, there were different problems. So tell me, what age group would you like to discuss?
Let's say 35 and under, and then let's say 35 and older.
Okay, so 35 and under, most young women would come in with either irregular bleeding, problems with their periods, severe cramping, what we call menorrhagia. Okay, that's heavy bleeding. Okay, dysmenorrhea, which is just painful periods. That was the most common problem I would see in younger women. Okay, in women 35 and above, there could be problems with infertility. There could be problems with fibroids, like you say, abnormal uterine bleeding. There could be problems with just sexual libido, and most of the time, if you had an abnormal pap smear, it was mostly with women over the age of 35 that you would see abnormal pap smears, which would be concerned about cervical cancer. Young women would more likely have infections. They would also have something called HPV, human papillomavirus, which can be a precursor to cervical cancer.
Wow, this is a great conversation that we're having, because so many people are dealing with that. With women that you were treating with heavy cramping, what causes that?
Okay, so it depends. You want to make sure that there's not a pathology there. So when a woman would come in with heavy cramping, you would first examine her to make sure the uterus was normal in size and the ovaries weren't enlarged. Okay, then you would check to make sure there aren't infections, and then you could do something. You can do what's called a ultrasound to just look to make sure that everything. An ultrasound is a non-invasive test. Okay. Now the feeling is that if all those things are normal and there's no actual pathology that you can see, what you think about something called endometriosis, which is an implantation of the lining of the uterus in other places other than in the uterine cavity. Okay, that's called endometriosis. The endometrium is the lining of the uterus. If that implants outside of the uterus, it can cause severe pain when you're having cycles. The other thing is the release of something called prostaglandins. When a woman gets a cycle and the cycle sloughs off, there's something called prostaglandins that can be released. And those prostaglandins cause cramping of the uterus. So those are the two most likely things that you're looking for when someone comes in with dysmenorrhea in a young, in a young woman, and even in an older woman, you're looking for those things.
Fascinating. Thank you for that. Endometriosis, is that something that can be treated naturally, or is that a surgical type of fix?
Okay, so the diagnosis, okay, in traditional medicine, the diagnosis is made surgically. You look inside, you do what's called laparoscopy. You look inside and you can see these implants. Okay. Now you can treat people, you can treat people without sort of having the diagnosis. You can say, I really think this might be endometriosis, so let's try this. And there are drugs that you can use to treat it. But the best treatment initially is to try to get someone to stop having cycles for a few months and see if their pain goes away. And I mean, that's if you're not going to do it surgically. No.
So it's two different routes.
And then, unfortunately, with African-American women or women of African descent, when you go into the emergency room or you see a doctor, they're most likely going to think that your pain is due to what we call infection, pelvic infection. So they're going to more look for like gonorrhea or chlamydia. They're not going to look for endometriosis, because for a long time there was a myth that African-American women did not get endometriosis. It was you only saw it in the Caucasian race. Now we know that's absolutely not true. So you have to think of endometriosis when you have someone that comes in with pain. Wow. And it can be in young women. It can be in young girls that are 16, 17. It doesn't have, you don't have to be older to have that.
Fascinating. Thank you for that. You sent me this great gift called the Iodine Crisis. Again, I'm going to keep it up here. All right. It says, What You Don't Know About Iodine Can Wreck Your Life by Lynn Farrow. Again, the Iodine Crisis. Dr. Naiden, thank you for sending me this. This is an excellent and wonderful book. What do people need to know about iodine? Can you maybe pull out some nuggets of your knowledge?
Okay. So basically, probably a large percentage of people are deficient in iodine.
Okay.
And deficiency in iodine comes because our diet is not rich in iodine. We don't have source. And the amount of iodine in iodized salt is just enough to make sure that you don't get a thyroid goiter. That's how it was put in iodine salt. So what we know, is basically Japanese women have a very low rate of breast cancer, and American women have a much higher rate of breast cancer. When Japanese women come over and they enter the United States and use our diet, their breast cancer rate is the same as ours. Okay. So we know that there's something in their diet. And so there's a guy by the name of Dr. Abraham. He's in that book, who went to explore why that happened. And what he realized is that the Japanese eat a lot of seaweed and eat a lot of seafood, and there's a lot of iodine in that. And when he looked at the American diet, we have very, very little iodine in our diet. And so he actually developed a test so you can test for iodine levels. Now, what he realized is that iodine is protective of the breast and of the ovaries and of the prostate. And fluoride, which is in your toothpaste and in your water, knocks off iodine. That's really, really important to know. Fibrocystic breast disease, which basically is very thick tissue in the breast. And if we were at a different forum, I would actually demonstrate to you the difference between fibrocystic breast disease and just a normal breast tissue. And a lot of women have fibrocystic breast disease. So if you test for iodine and your iodine levels are low and you give someone iodine, you can get rid of fibrocystic breast disease. Okay. And the test for iodine is a very simple test. It costs about $125. And the iodine is very, very inexpensive. Also, what he showed is that ovarian cysts, women that get ovarian cysts, if you give them iodine, it gets rid of their ovarian cysts, assuming that it's not a pathology like a cancer. or it's not due to endometriosis, because you can get cysts from endometriosis on the ovary. So what I think every woman, and unfortunately insurance companies don't pay for this, but I think every woman once a year should have an iodine test. What I've noticed is that women who have breast cancer, when I do their iodine test, their iodine levels are very, very, very low. And the way that test is done is basically you stay away from certain foods for 5 days. On the morning of the 6th day, you take iodine, and then you collect your urine for 24 hours and you send it off. If you have enough iodine in your body, you will excrete most of the iodine that you took in by mouth. If you have not enough, your body holds on to iodine, a certain percentage of it. And every woman that I've done who's had breast cancer has an iodine level of 40% or below. And women, every woman that I've had that I've tested. Now I haven't tested every woman with breast cancer. A simple test. To me, if you did an iodine test on every woman at least once a year, and you check their level and it was low, it was say 65 or 70, then you give them iodine to protect their breast, as opposed to waiting till they have breast cancer and then you're treating them for breast cancer.
Fascinating. I also know that iodine is a great natural treatment for women who have thyroid conditions.
Yes.
Can you speak to hyper and hypothyroidism? What's the difference, and how this subject matter is connected?
Okay. So basically in your brain, in your pituitary brain, you produce something called TSH. Okay. TSH goes to your thyroid, which is in your neck, and it allows you to produce T4. Okay. So basically what happens when you're hypo, HYPO, meaning too little, it means that your body is not producing enough of that T4. And T4 actually gets converted to T3, and T3 is really the active form. So when you're hypothyroid, you don't have, and your TSH levels are high because your body's saying we need more T4. There's a feedback mechanism. If you have enough T4, the TH level falls. If you don't have enough T4, your TSH level rises. But you have to look at the big picture of what's causing the T4 to not be high enough. Now, you can make antibodies, and traditional doctors do not do this test unless you go in and ask them to do it. You can make antibodies against your thyroid. And when you make antibodies, it's like something attacking your thyroid. When that happens, your T4 level falls and your TSH level rises. And that's hypothyroidism, hypo, not enough. And that's called Hashimoto's disease. Now, you can have a problem with your thyroid that's just due to iodine, because you have to have iodine in order to make T4 and have T4 convert to T3. So if you don't have enough iodine, you won't make T4. So if your T4 is low and you don't have any thyroid antibodies, you want to give people iodine so they can make T4. Now, again, this is a little technical. You also need to make T4 go to T3. And there's some things like selenium that you need to make T4 go to T3. If you have Hashimoto's, if you have hypothyroidism, you need to make sure that you don't take in gluten, because Hashimoto's is considered an autoimmune disease, that your body's making antibodies against itself. And gluten, when you take in gluten, unfortunately, if it gets crossed over into the blood makes antibodies against the gluten, and that those antibodies look exactly the same as your thyroid. So your thyroid starts getting attacked. So the first thing you'd want to do if you have someone with hypothyroidism is take them off gluten. Gluten. Okay. Hyperthyroidism. Now that's when you have too much T4. And that can be autonomous, like you can have a tumor that's causing you to have too much T4, or you can have something going on in the brain, in the pituitary, that's where the TSH is not, there's not a feedback mechanism, and the TSH just keeps pushing and pushing the thyroid for you to make T4. With hyperthyroid people, hyper, HYPER, they're going to be nervous, anxious, they're going to be thin. They're going to be fatigued. They're just not going to, they're just not going to be able to concentrate. Okay. So one of the things with hyperthyroidism, which we see a lot less, is that it's a little bit more, you worry a little bit more because you have to find the etiology. Why is this person having anxiety? Why are they always up and fidgety? Why can't they concentrate? And those are things that doctors need to look at when they start looking at people and saying they have anxiety.
This is fascinating. So hyperthyroidism, production of too much, hypo, not enough. So
Exactly.
hyper seems to be a bit more of a issue than to treat or than hypo. Is that correct?
Right. And the etiology is more serious with hyper than hypo. You'll find people with hyper, they may have bulging eyes. Okay. They if you look at their tongue, their tongue may be what we call a scallop tongue. There's just a number of different signs, and it's more serious. And they can have cardiac problems where their heart is going really, really fast.
Fascinating. This is fascinating. I could talk to you all day. I'm not, but I could. This is great. Now, let me ask you a couple questions, and then we'll get to maybe fielding a couple of questions from the people, and we'll wrap things up. You talked about getting the iodine test. You talked about all of the women, which is fascinating, that you treated with breast cancer had numbers under 40, I think you said, right? Fascinating. You said that it was protective for the breast, the thyroid, and the prostate.
Yes.
So, but once again, we don't need to take iodine blindly, supplements. We need to be tested, correct? Can you speak about that type of test so people will know where do they get it? Can they get it from their doctor? How can we get it?
Probably only functional, because I mean, there, in everything there's a controversy, and traditional doctors are really, really resistant to any type of change. They say it takes 17 years for medicine to change in what it sort of tells people to do. So if you go to a traditional doctor, they're going to be afraid of iodine. They're going to say, oh, no, iodine's going to be harmful. No, we're not going to do this test. So only probably functional medicine doctors or special doctors like myself will do the iodine test. Now, if you read that book, in that book, it does tell you how you can actually get the test done. But because you really want to know your level, you really want to know before you do even with vitamins and minerals, I really think you want to know where you are before you start,
Yeah. Instead of taking it blind, unless it's vitamin C or something that's
you're gonna urinate out. Like
you're gonna
urinate out. B complex vitamins, you're gonna urinate out. But if your level is low and if you're having symptoms, you really want to know, are my symptoms just a nutritional deficiency that I can correct, as opposed to going to a doctor and getting an antidepressant? I mean, it's just incredible. Traditionally, we've been taught to use medications and prescriptions, but there's so many things that are natural that we could really look into. But again, it takes a lot of time. It takes effort. You can't sit with a patient 15 minutes and learn what you need to learn. And that's how traditional medicine really operates. 15 to 20 minutes is as long as you're allowed really with a patient.
Fascinating. What I want to do is field a couple of questions. I want to talk more about your practice so people can know how they can reach out to you. Okay. And then I want to ask you before we leave, maybe you can address this now. Someone who is maybe not in Atlanta, and they're in Chicago or they're in Los Angeles, and they're looking for a functional
medicine
medical doctor. How do we find a good one?
Okay, so there's the Institute of Functional Medicine, and they can actually go to the Institute of Functional Medicine and actually see, and they'll give you a list of doctors in your area.
Institute of Functional Medicine.
It's called IFM.
Okay. All right, let me hold on one second, gang. I'll bring that up. Actually, all right, so you can keep speaking to that. So basically,
and the other thing is that if I have a great respect for naturopaths, because to me, naturopaths, they approach medicine differently. Now, not all of them are equally qualified, but I think if you can't find a functional medicine doctor, you might want to talk to a naturopath and see what the naturopath mentions to you, because naturopaths tend to approach things in a more natural fashion.
Is that correct? What's on the banner?
Yes, that's it.
Institute of Functional Medicine, gang, IFM. You can go to that site. You can put in your information. It'll help you find it. Do your own research. Look at reviews. Make a good decision about that. But don't get into these types of things blindly before you are tested. That is excellent. Okay, let's look at. Well, I'll get to someone's asking about your location, but I want to end with that because I want to be certain that we know all of that. Let's take some a couple of questions. All right, all right. Let me. Okay, all right. Marion McGee. She says, "Are there any natural remedies or recommended iodine levels for hyperthyroidism caused by Graves' disease?"
Okay, so if you have hyperthyroidism, you do not want to be taking iodine because, again, what it's saying is that you have too much T4, and therefore iodine would really put you into crisis. So if you have, I mean, you can be tested to see what your iodine levels are, but you definitely, I mean, again, hyperthyroidism is a much more difficult to handle than hypothyroidism.
Okay. Wow. So that's
so
excellent.
so no iodine, definitely no iodine.
Okay, no iodine. Excellent. Okay. All right, I'm gonna go to some more questions you all may have. Gina M. Wright Lee says, "Why are so many Black women developing HER2 breast cancer?"
HER2 breast cancer.
Yes.
Okay, so breast cancer, there are really three major types of breast cancer. There's some with estrogen receptors, one with protein receptors, one with progesterone receptors, and then there's triple negative. Okay, it really depends to me. When you talk about HER2 breast cancer, it probably has, to me, the exposure of the estrogens that people are taking in. Really, you have to. I mean, I truly do believe that toxins in our environment are a big cause, and our immune system being depressed is the second cause. Now, I would have to really look at that individual person and look at what their lifestyle is and what's been going on and what they've taken, what medications what have they been exposed to? Have they been exposed to a lot of lead or mercury? There's so many other things than just saying across the board, this is what causes it. I think the one thing I do is I look at every case individually. There's not like, I don't lump things together, Part of holistic medicine is looking at the whole body, not looking at just the one part. You want to look at the whole body to see what's functioning and what's not functioning.
Fascinating. This is great. So let's see. Charlene Johnson Calhoun says, "What is the difference between a full hysterectomy and a partial hysterectomy?"
Okay, so this is major, and gynecologists and internists have gotten this so totally wrong. It really upsets me. Okay, hystero just means uterus. Okay, hystero just means uterus. Ectomy means the removal of. Okay, so when you have a hysterectomy, by right, it just means that your uterus is removed. When you have a partial hysterectomy, what it's supposed to mean is that they've left your cervix and cut off the top of the uterus. Okay, but that's not how doctors define it. Doctors define total hysterectomy as taking your uterus and your ovaries and your tubes. Now, that procedure is really called a bilateral salpingo-oophorectomy and hysterectomy. Ovaries are called oofos. So when a doctor says you've had a full hysterectomy, he's assuming that you had your ovaries removed and your uterus removed. That is not the way it should be. And doctors should really correct patients. Now, when they say a partial hysterectomy, what they're saying is that you just had your uterus removed. That is not the way it should be. That's not even the medical terminology. And why that has persisted and why doctors have not corrected it, it's horrible. I mean, when I tell a patient, not that I don't do this anymore, but when I tell a patient I'm going to do a hysterectomy on you, I mean, I'm just taking your uterus. If I say I'm doing a partial hysterectomy, I'm only taking the top of your uterus. I'm leaving your ovaries and your tubes. And when you take the ovaries, and in a woman who's having periods, they automatically go into menopause. That's surgical menopause when you take the ovaries. So if anybody says they're going to do a hysterectomy, you want to ask them, what organs are you taking? Are you taking my ovaries or are you leaving my ovaries? Because just using full hysterectomy and partial hysterectomy no longer holds a good answer.
That's antiquated rhetoric.
Yes, you want to say, tell me what you're actually taking,
Okay, thank you. All right, Marcy Joy says, "Can you please discuss your advised approach to birth control to younger women under the age of 35?"
Okay, so I'm not a great, I will do, I'm not a great proponent of birth control pills. I just am not. And I can, I can go into the studies that I've seen why. But
Mm,
again, it depends on the woman, and it really depends on how she feels. If she comfortable putting her hands in her body? Is she comfortable using a diaphragm? Is she comfortable using an IUD? I have to, again, it's, to me, and what would happen if she got pregnant? If someone said,
mm,
if I got pregnant, I would have to have an abortion. Then I'm going to say, we have to make sure that we protect you in the best way possible. And I would give her options. Now, let me tell you, if you have a partner and he's willing to use a condom
mm,
and you're willing to use contraceptive jelly, and you know your cycle, if you use condoms and contraceptive jelly, they can be, if you use them together, they can be as effective as birth control pills.
mm.
But you have to have a partner that's really willing to do that. If you don't have a partner that's willing to do that, we're going to talk about other things. We're going to talk about when is the time that you're most likely to get pregnant. The
Yeah.
time that you cannot get pregnant is 7 days before your period. You cannot get pregnant. If you know when your period is going to come, 7
Mm,
days before then, the egg only lives for 24 hours. The problem is that sperm cells can live for 5 to 7 days. So your egg, when you ovulate, it's only going to live for 24 hours. If it doesn't get fertilized in that 24 hours, you're not going to get pregnant. But sperm cells can live for 5 to 7 days. So you can have sex 5, 7 days before, and then you ovulate and you get pregnant.
mm.
So,
Fascinating.
so when I talk to women, I need to find out what they want and what they want to accomplish. Okay,
Mm.
because there's just not one size that fits all.
Right, right. You need more follow-up questions.
Yes.
Absolutely. All right, Gina, I'll take a few more. Is the IV contrast dye equivalent to the same type of iodine that we should consume? I'm asking because I'm allergic to IV contrast dye.
Yeah, it really, I would have to say that you probably should stay away from iodine because it's an iodine-based dye that they use. So I would not be comfortable giving you iodine by mouth.
Mm,
You know,
okay.
but I can research that more with the people with people to see. But I don't recommend, if you have IV contrast dye allergies, I don't recommend iodine.
Okay. All right. All right. Do you think uterine ablation will slow down menopause?
No, it will not slow down menopause. Uterine ablation, what it does, it burns out the lining of the cavity, but your ovaries still produce eggs. So the thing is, you may not have cycles, but as long as your ovaries are working, then you're not in menopause. But you
Mm,
don't have cycles, so you might think you're in menopause, but you're not. Okay.
mm, mm. All right. Cheryl Royal says, any suggestions on how to ease very severe night sweats?
Yeah, I really, we can start with something that's herbal. There's
Mm,
something that's called Simplex F, and if I'm going to give you I'm going to give a number to text me, and people can text me with
okay.
their name and date of birth and a question that they ask. So at the end, I'll give you some information of how you can reach me and what I can, because I always like to know a lot about what's going on because a number of things can cause night sweats, but the most common cause, depending on your age, it may be menopause.
Now, Dr. Naiden, when my people I got, they like the mob. If you give if you give them a number, okay. So let's talk about it because this has been such a great conversation. Talk about your practice. I want to know where you are. How can people reach you? All of those things. I'm gonna try to. I want to really take my time because I really want to be certain that we promote all of what you're doing. I think you're just a amazing human being and fabulous woman. I'm so glad that we've met, and I can't wait. So, tell us whatever we need to know.
Okay, so basically, I'm really trying to do more prevention than intervention in the practice. So I only really see patients on 2 days, on Tuesdays or Saturdays. Okay.
Mm-hmm.
Usually I spend at least 2 hours with each patient.
Mm-hmm.
And basically, it's a cash-based practice, meaning that you can have certain labs drawn with insurance, but as far as the visits, their out-of-pocket expenses.
Mhm.
You can do a consultation with me. Say, for instance, you had labs done at another doctor's office and you just want to do a consultation. You want to go over and have the labs explained. We can do a phone consultation, and then there's a charge for a phone consultation, and we can talk about what the labs mean and what you should do.
Mm.
Or if you have a medical problem and you just want to talk about it, we can do a phone consultation. In my office, I do, as Dr. Williams probably knows, Pastor Williams, I do IVs, and IVs are done for different purposes. And then you have to have certain blood work before I can do the IV to make sure that you can actually get high dose vitamin C and B vitamins and all. And anytime you get anything through an IV, you absorb it 100%, where if you take it by mouth, you only absorb 15%. So whatever you're taking in, whatever vitamin or mineral you're taking in, you're only absorbing 15 to 20% of that when you take it by mouth.
Wow.
So, my practice on Saturdays, I'm in Smyrna, and that address is 3822 Highlands Parkway Southeast.
And what's the name of your practice?
It's OBG. It really has two names. It's OBGYN Women's Specialists of Georgia, PC. And then because I see men, I have Advancing Health and Healing is another part of the practice.
Okay. All right.
And then on Tuesdays, usually I'm 3 Tuesdays out of the month, I'm at Buford Highway. And that address, do you want that address?
Oh, hold on one second, because let's see, I got that. Advancing Health and Healing. All right. All right. Is there if a person is trying to book you, is there a number they need to call? Is there a website?
Okay. So there's a number. The number is 404 284 5498.
Okay.
Or they can text 404 914 2694 with their name, their date of birth, and what kind of appointment they want.
And type of gang. I know y'all are impatient. I'm gonna get this up because I want to be certain that we are clear. Okay. So check this out. I use 2 apostrophes.
Specialists of Georgia, Advancing Health and Healing. Yep. 2845. Takes 4. Yes. Okay. And usually we'll call you back. We'll call you back and talk to you and give you a time.
Yeah. So OBGYN Women Specialists of Georgia, and the men Advancing Health and Healing.
Right.
404 284 5498. All right. That's that number. You can text 404 914 2694. Leave your name, date of birth, and the type of appointment. Now, we've already talked before. I'm going in to see Dr. Naiden. We're going to do some, I'm just going to let her, I'm going in. I can't wait for to do that. But Dr. Naiden, thank you so much for being our guest. We're going to have you back. Every session, I want you to be one of my stand-ins so we can have a conversation. I want to bring you to our church because there's so many. I think we can have we can do a live event there and do it in person, especially being that you're so close. We're so close to each other. But thank you so much for taking time. Gang, show Dr. Naiden some love. They just think the world of you right now. So Dr. Naiden, thank you for joining me. Is there anything else that you want people to know? Is there anything else that you are that you need to share?
I just want people to really cut down on sugar. I mean, if you can do that for me, I would be really, really pleased.
Y'all heard it.
Yeah.
All right. Well, Dr. Naiden, thank you. You've been just a joy. I've enjoyed this conversation. I could do it all night and have this conversation with you. Thank you for joining me. I hope you have a blessed evening. I look forward to speaking with you again soon.
Yes. Thank you so much for having me. Okay.
All right. Thank you.
Take care. Bye-bye.
Yeah. What a great guest, gang. I hope you have enjoyed it. I'll leave that information on the screen. Gang, I told you it was going to be epic. What a great conversation. Isn't she just a beautiful woman? Isn't she just a beautiful person? I mean, we talked about cancer tonight, dementia, menopause, hyperthyroidism, hypothyroidism, iodine, My brain, excuse me, is about to explode right now. So take some time, gang. You can share this particular presentation with family members and friends that you know. If you guys have people here in Atlanta, hit her up. I'm going to be certain that before this year is over, she's going to be the hottest, biggest holistic doctor, household name right here. I'm going in this week. I'm going to document when I go in there the services that she's going to do, my experience. I can't wait for it. I'm so glad that we were able to have this conversation. I'm going to get her to my church. We're going to have it's just going to be great. So I'm so excited. Gang, listen, have an amazing day. To those of you all who are participants of the 40-day turn up, the world's greatest transformational process, we are in the last stretch. All right. On tomorrow morning, I'm going to have for you your statistical review and performance analysis as we've done heretofore. I'll see you guys at some point in the morning. I'll let you know that. I'll give you an update, housekeeping. We've got a super weekend on next weekend. We've got our debriefing. We've got our Blueprint for Wellness event. We've got our autoimmune recap. We've got our in-person graduation next Sunday. We got a lot going on, gang. Have an amazing day. Thank you for joining me. I told y'all I was going to be fire. All right. Love each of you. Have an amazing day. For those of you who want to know and want to connect with me and want to connect with us and want to know exactly who we are, you can go to journeylife.tv. Actually, you can go to Facebook, Instagram, and right here on YouTube. All the handles are the same, at Journey Life TV. You can find us there. Follow those pages, whether it's Instagram, Facebook, or here on YouTube. We got a lot of great content. Until next time, be well and be blessed. Have an amazing evening, gang, and I look forward to seeing you guys again soon. Peace.